Stop for a few seconds. Breathe. And think carefully about this. How is it possible that a society richer, more productive, and more technological than ever before is sicker, more indebted, and more exhausted than it was 50 years ago? In the 1970s, the United States had no smartphones, artificial intelligence, internet, or ultra-sophisticated medical exams. But there was something that today seems rare: security, predictability, and real access to basic life necessities. Today, we have more technology, more information, more advances. And yet, people are more anxious, more depressed, sicker, and more insecure than ever. This is not a coincidence. And it is definitely not just nostalgia. Healthcare in the 1970s, simple, imperfect, but accessible. In the 1970s, the American healthcare system was not perfect. There were inequalities. There were technological limitations. There were real problems. But one thing was clear: healthcare was not a luxury product. Most people had employer-provided health insurance, relatively predictable medical costs, less bureaucracy, less fear of going to the doctor. A medical appointment cost the equivalent of a few hours of work. A hospital stay did not automatically mean financial ruin. Common medications were affordable for the middle class. Going to the doctor was not a choice between taking care of your health or paying the rent. Today, for millions of people, that is exactly the choice they face. Today, first world medicine, third world access. We have advanced technologically. But we have regressed socially. Today, the United States has the most expensive treatments in the world, the most sophisticated hospitals, the most advanced medications, and at the same time, millions without adequate health insurance. People avoiding care out of fear of the cost. Medical debt as the leading cause of personal bankruptcy. A simple emergency room visit can cost thousands of dollars. A basic surgery can generate debt that lasts decades. A wrong or delayed diagnosis can financially destroy a family. The brutal question is: what is the point of having the best medicine in the world if most people cannot use it without fear? Health insurance, from benefit to trap. In the 1970s, health insurance was seen as protection. Today, for many, it has become a financial trap. High copayments. Absurd deductibles. Limited coverage. Surprise bills. You pay every month. You pay when you use it. You pay when you need it. And still, you don't know how much it will cost in the end. This creates a silent and devastating effect. People delay medical care. They ignore symptoms. They skip exams. They wait until they're sick enough to justify the cost. In the 1970s, this behavior was the exception. Today, it has become the rule. Mental health, the invisible price of modern stress. Here is a deep difference between generations. In the 1970s, life wasn't easy, but it was more linear. You worked, earned, paid bills, planned for the future. Today, life is a psychological minefield. People live with constant fear of losing their job, accumulated debt, unpredictable costs, pressure to make it, constant comparison on social media. The result? An explosion of anxiety, depression, burnout, psychiatric medication use. Never has mental health been talked about so much. And never have people been so mentally exhausted. This is not individual weakness. It is a toxic environment. Working more, sleeping less, living worse. In the 1970s, a typical workweek allowed someone to support a family, buy a house, take vacations, build retirement. Today, many people have 2 or 3 jobs. Work longer hours. Sleep less. Live on the edge. And even so, they can't move forward. This creates a dangerous collective feeling. The sense that effort no longer pays off. And when effort stops making sense, something deep breaks in society. Public policy, yesterday prevention, today reaction. In the 1970s, public policies focused more on prevention, expanding access, building infrastructure. Today, much of policy is reactive. Putting out fires. Dealing with crises. Patching up collapses. The system does not act before. It acts after. After the person is already sick. After the debt already exists. After the damage has already been done. And who pays for that delay? The ordinary citizen. The uncomfortable question. If our parents and grandparents lived in a country that was less rich, less technological, less productive, but still managed to have access to health care, emotional stability, basic security, then we must ask, without fear, what exactly improved for the average citizen? And more importantly, who actually benefited from this so-called progress? If you want, in the next message I can continue with part 2, going deeper into detailed historical data, medical inflation, regional comparisons, the collapse of the social contract, and the likely future if nothing changes. Let's do a simple, and extremely revealing, exercise. We're not going to talk about medical technology. We're not going to talk about hospital quality. We're going to talk about just one thing. How much an ordinary person had to spend when they got sick. Because that's where reality appears without makeup. The 1970s, getting sick was a problem, not financial ruin. In 1970, the federal minimum wage in the United States was approximately $1.60 per hour. That meant a full week of work earned around $64. A full-time month of work was close to $256. Now let's look at average medical costs at the time. Doctor's visit. A medical consultation cost between $5 and $10. That represented 3 to 6 hours of work at minimum wage. In other words, a person could pay for a doctor's visit with less than 1 day of work. Basic tests. Simple blood tests, $5 to $15. X-rays, around $20 to $30. Even combining a visit plus tests, the total cost usually stayed within 1 or 2 days of work. Medications. Many common drugs cost only cents or a few dollars. Basic antibiotics were affordable. Most families didn't have to choose between medicine and food. Important. Even without health insurance, these costs were manageable for a large share of the working population. Getting sick was inconvenient, caused worry, but rarely financially destroyed a family. Today, getting sick can cost months, or years, of work. Fast forward to today. The federal minimum wage is $7.25 per hour, unchanged since 2009. That means about $290 per week. Roughly $1,160 per month, before taxes. Now let's look at the real costs of modern healthcare. Doctor's visit today. A basic appointment without insurance costs $150 to $300. In many regions, it's even higher. In minimum wage terms, that's 20 to 40 hours of work. In other words, a full week of work just to be seen, and this is for a simple visit, not a specialist. Medical tests. Basic blood work, $100 to $300. Simple X-ray, $200 to $500. MRI, $1,000 to $3,000. Even with insurance, copays and deductibles can easily exceed $500. $1,000. Or more. For someone earning minimum wage, that equals several weeks. Or entire months of work. Medications today. Basic prescriptions, tens of dollars. Maintenance medications, hundreds per month. Insulin and chronic treatments, thousands per year. Today, it's common to see people cutting pills in half, skipping doses, delaying treatment. Not out of irresponsibility, but because of cost. The shocking comparison. Let's put this brutally clearly. 1970s. Visit plus tests plus medication. Cost, a few days of work. Financial impact, temporary. Today. Visit plus tests plus medication. Cost, weeks or months of work. Financial impact, debt, stress, fear. Before, the system was imperfect, but proportional to wages. Today, the system is advanced, but disconnected from workers' reality. Health insurance, the illusion of protection. Some might say. But today we have health insurance. And here's the problem. Today, even with insurance, deductibles of $2,000 to $6,000 are common. High copays. Confusing coverage. This means many people pay every month. And still can't afford to use the system when they need it. In the 1970s, insurance actually protected people. Today, it often only reduces the size of the disaster. The psychological cost of price. Here's something that doesn't show up in statistics, but changes everything. In the 1970s, people went to the doctor when something felt wrong. Today, people first ask, how much is this going to cost? That single shift destroys the logic of prevention. Simple illnesses become serious. Treatable problems turn into crises. And the final cost becomes even higher. The inescapable reality. When we compare the numbers, it becomes impossible to ignore. Wages did not keep up with medical costs. Healthcare drifted away from real income. Getting sick became a financial risk. And this leads to an uncomfortable conclusion. Today's worker faces greater financial danger from illness than a worker in the 1970s. Even while living in a richer country. Before we wrap up, it's worth tying together everything we've seen so far, because when all the pieces come together, the picture becomes impossible to ignore. Throughout the video, it became clear that the comparison between the United States of the 1970s and today goes far beyond nostalgia or personal opinion. It reveals a deep shift in how everyday life works for people who depend on their own labor. In the 1970s, even with less technology and less total national wealth, there was something essential: proportionality. Wages, even if low in nominal terms, aligned far better with prices. Working made it possible to live, plan, and even get sick without fear of financial collapse. When someone got sick back then, the problem was a health issue, not an economic survival crisis. Doctor visits, tests, and medications cost hours or a few days of work at minimum wage. Going to the doctor didn't require complex calculations or painful choices between paying bills and taking care of one's body. Healthcare was imperfect, yes, but accessible enough not to destroy an entire family. Over the decades, something broke. Today, the country is richer, more productive, and more technological than ever, yet access to basic life necessities has become more expensive, more bureaucratic, and more uncertain. The minimum wage has grown far more slowly than essential costs, especially healthcare and housing. Getting sick stopped being just an inconvenience and became a real financial risk. A simple doctor's visit can consume an entire week of work. Tests and medications can easily turn into months of accumulated effort. Even what is supposed to protect people, health insurance, often doesn't truly protect them. High deductibles, co-pays, and surprise bills mean millions of people pay monthly for coverage they are afraid to use. The result is a silent but devastating behavior, delaying care, ignoring symptoms, treating the body as something negotiable. Not by choice, but by necessity. This constant pressure doesn't only affect finances. It weighs heavily on the mind. Economic stress, insecurity, and the feeling of working more while achieving less create an environment where anxiety, burnout, and exhaustion become common. Never has mental health been discussed so widely, and never has it been so hard to maintain balance. Not because people became weaker, but because the system became heavier. The generational contrast makes this even clearer. The 1970s generation faced its own challenges, but followed a more predictable path: work, stability, access to basic services, and the sense that effort made sense. Today, many people do everything right. They study, work, and push themselves, yet still feel permanently on the edge of falling behind, sinking into debt, or burning out. In the end, the question running through this entire video remains in the air: how did a society that advanced so much manage to make everyday life harder for those who sustain it with their own labor? What changed wasn't just the price of things, but the relationship between time, effort, and dignity. And as long as that relationship remains unbalanced, the feeling that something is wrong will not disappear, because it isn't an illusion, it's a consequence. Looking to the future is not an exercise in imagination, it is a necessity. Everything discussed so far does not end with the current generation. On the contrary, it projects itself even more intensely onto those who come next. Future generations will not inherit only a different job market or new technologies, they will inherit a heavier, more expensive economic model with far less room for error. Those entering adulthood today already face a worse starting point than previous generations. The cost of living begins high and keeps rising. Education requires debt before a first stable job even exists. Housing consumes an ever-growing share of income. Healthcare has become a permanent financial risk. And all of this happens while wages grow slowly, unable to keep up with escalating costs. The result is a generation that begins professional life under pressure, without the space their parents and grandparents had to make mistakes, learn, and recover. This reality directly affects family structures. Parents who are still paying their own bills end up supporting adult children for longer. Grandparents help both children and grandchildren at the same time, often compromising their own retirement. Family support, once complementary, becomes essential for survival. This creates prolonged financial dependence and strains relationships, turning the home into a constant point of tension, not because of a lack of love, but because of a lack of resources. Traditional milestones of adulthood are being pushed further and further away. Buying a home stops being a realistic goal and becomes an exception. Having children is delayed or abandoned for purely economic reasons. Marriages are postponed, career changes are avoided, and personal dreams are shelved. Every decision is filtered through the same silent question: can I afford this? When that question dominates life, the cost is not only financial, it is psychological and social. Another profound effect is the transfer of risk. In the past, much of life's risk was absorbed by the system: more stable jobs, more accessible health care, more predictable retirement. Today, those risks are pushed almost entirely onto the individual and their family. If someone gets sick, loses a job, or faces an unexpected crisis, there is no sufficient safety cushion. The consequence is chronic debt that does not disappear over time, but accumulates and crosses generations. This intergenerational debt creates a cycle that is difficult to break. Indebted parents have less ability to invest in their children's future. Children begin adult life with less support and more obligations. Social mobility slows down. Effort stops guaranteeing progress and begins merely preventing collapse. This deeply changes how people view work, merit, and hope. If current trends continue, the future will be marked by families working longer hours, taking on more risk, and receiving less security in return. The economy stops being a tool for progress and becomes a constant source of anxiety. Long-term planning becomes nearly impossible because the present already consumes all available energy. Living on the edge stops being the exception and becomes the norm. The impact goes beyond numbers. A society in which future generations believe they will live worse than their parents is a society under permanent tension. Trust in the future erodes. The sense of belonging weakens. And when people stop believing that effort will be rewarded, something fundamental is lost in the social fabric. The warning is clear and unavoidable: when the cost of living rises faster than families' ability to sustain themselves, the problem stops being temporary and becomes structural. Future generations will feel this weight even more intensely, not because they failed, but because they inherited a system that is more expensive, more rigid, and less tolerant of mistakes. Understanding this now is not pessimism, it is the first step toward preventing a future even harder than the present.